see you in the Zoom. Okay, great.
Good morning, good afternoon, and good evening. We kindly request for participants to please add your information with your name and organization that you are with in the chat. Thank you. As part of housekeeping, I'd also like to remind everyone that there's a Q&A button for the Zoom meeting that allows participants to submit a question for the panelists and speakers to respond in answers. There'll also be an opportunity to have question and answers at the end of the webinar. Good morning, good afternoon, good evening. Thank you for joining. You're allowing 1 more minute for more participants to join on, recognizing that there might be some technical difficulties. And we kindly request participants to please put your name and the organization that you are with in the chat if you so desire. Greetings. My name is Commander Alpa Patel Larson, and I serve as the Director for the Division of Global Programs in the Office of Global Health and the Office of Special Health Initiatives here at the U.S. Health Resources and Services Administration, HRSA. So I'm pleased to welcome you to the pre-application call for the Notice of Funding Opportunity HRSA-22-160, Leveraging Health Service Equity Approaches for Sustainable HIV Epidemic Control. There's a new chapter for HRSA and the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, as we build upon lessons learned from COVID, and we welcome new leadership of the Department of State and the Office of Global AIDS Coordinator, as Ambassador Nkunga-san was sworn in yesterday. Since PEPFAR started in 2003, HRSA has been an active partner in the U.S. government's mission to end the HIV/AIDS epidemic. And this award will be vital to HRSA's continued success and participation. So we thank you for your time and participation on this call, and I encourage you to read the entire NOFO and respond as outlined in this Notice of Funding Opportunity. Next slide. This NOFO is very much aligned with the vision of HRSA and Office of Global Health about healthy communities and healthy people worldwide, and is aligned with our mission to improve the health of Americans through global action by providing leadership to really develop those linkages, foster interconnectedness, and facilitate a mutual exchange of expertise that strengthens systems of health systems, access, workforce, equity, and quality. Next slide. The purpose of this the purpose of this call is to provide a general overview of the application and an opportunity for applicants to ask questions to ensure clarity on the application requirements. And this NOFO, Leveraging Health Service Equity Approaches for Sustainable HIV Epidemic Control, and HRSA's SF-424 application guide should both be your primary resources for the application instructions and guidelines. We kindly request that you include any questions and answers in the Q&A button, and they will be compiled into a final frequently asked questions document that will be uploaded onto HRSA's website. Next slide. I'd now like to introduce Laura Foradori, the project officer for this Notice of Funding Opportunity and the International and Public Health Analyst in the Office of Global Health, Division of Global Programs. Thank you, Laura.
Thank you, Alpa, and good day, everyone. As Alpa said, this is Laura Foradori. I'm a public health analyst and project officer in HRSA's Office of Global Health. This slide just displays the outline of the presentation today. We're going to walk you through the different sections of the NOFO and some resources, and then have an opportunity for questions and answers at the end of the presentation. Next slide. The purpose of this funding opportunity, which is a cooperative agreement, can be found in pages 1 through 3 of the NOFO. It's funded under the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, and the purpose is to develop and expand unique platforms to bring best practices from domestic experiences to assist the global HIV/AIDS program to sustain the goal of reaching epidemic control in Malawi, Zambia, and other PEPFAR countries as they are identified. Next slide. This is a summary of the award. The application due date is August 5th. This will be a cooperative agreement. There's anticipated 1 award to be made with estimated maximum funding per year of 10 million. The period of performance will start on September 30th, 2022 and last for 5 years. And it is to support Malawi and Zambia and other PEPFAR countries as they are identified. And additional details can be found in pages 1 through 3 of the NOFO. Next slide. The next couple of slides will outline the eligibility information. The first bullet just lists out the various entities and organizations that are eligible to apply for this NOFO. So please read that in detail. Cost sharing or matching is not required for this program. And HRSA is recommending that applicants form a consortium with demonstrated history of collaboration to support activities for HIV prevention, care, and treatment in underserved areas, both in the US and globally. Next slide. This next slide has some additional details about the recommended consortium. There should be at least 3 or more separately owned entities, including the applicant organization, if you form a consortium. The entity should have different EINs, but have an established working relationship. Consortium members will need to function in PEPFAR countries as one unified entity under one name when interacting with the host government, the US government PEPFAR team, and other stakeholders. We'll request that you provide documentation such as a letter of commitment to describe the responsibility of the various members for the proposed work plan and signed by all consortium members. And the applicant that applies must meet the eligibility requirements and will assume all legal, programmatic, and financial responsibilities under the award. And then the consortium participants would be considered subrecipients of the award funding, irrespective of how the agreement between the entities is labeled, but are also subject to all terms and conditions of the award. And you can see more details about these requirements, or this recommendation in pages 6 through 7 of the NOFO. Next slide. In addition, sorry, go back one slide. Yes, HRSA may consider an application for funding non-responsive if any of the following criteria are noted, which is that if it exceeds the ceiling amount, exceeds the application page limit, or does not satisfy the deadline requirements. Please note that multiple applications from an organization are not allowed, and we will accept only your last validated electronic submission to grants.gov. Next slide, please. The following slides, few slides go through the program description, which is in the program requirements and expectations section. So this is a cooperative agreement. It should be a collaborative effort aimed at continuing and scaling current HRSA activities for impact in HIV/AIDS treatment services in Malawi, Zambia, and other PEPFAR-supported countries. It should address social determinants of health and inequalities found within the healthcare system to improve the delivery of quality HIV/AIDS services. And there should be formulation and delivery of assistance for high impact solutions across the range of interventions that are necessary to attain durable HIV epidemic control. Next slide. This provides more details on the focus of the funding, which is to address and continue the following program areas, which are related to empowerment and linkage to health services among adolescent girls and young women that reside in targeted areas, to increase the capacity of health facilities to improve linkage and continuity of HIV care, to partner with high volume treatment sites to provide differentiated service delivery models that address treatment interruption and improve viral suppression rates, to use quality improvement and family-centered strategies to support the care needs of mothers and their HIV-exposed infants throughout pregnancy and the postpartum breastfeeding period up to 24 months, and ensure optimized client care records and reporting systems and related data use to improve the HIV continuum of care at all stages. Next slide. Next slide, please. And then the program's priorities should aim to and focus on advancing equity of access to high quality person-centered care, to introduce innovations that target HIV care and treatment services in subpopulations that lag behind in reaching and sustaining epidemic control, and to integrate HIV prevention care and treatment services into country-led programs in PEPFAR-supported countries to ensure continued gains towards reaching and sustaining HIV epidemic control. Next slide, please. And then the key program objectives to keep in mind are to provide strategies for advancing health equity in host countries towards continued sustainability of HIV programs as these programs approach the achievement of PEPFAR goals, to introduce innovations to reach subpopulations with unmet needs, and provide result-driven, innovative implementation models for sustainable HIV epidemic control, to determine and disseminate best practices and innovative models that are person-centered and address social determinants of health for high-quality health services, to strengthen health system capacities to enable seamless transition of HIV services to host country governments across PEPFAR-supported countries, and monitor and evaluate the process of transition to assure maintenance of positive health outcomes and performance results over time. Next slide. This slide just details the sections for the submission information that are in the SF-424 application, and I'll go through these in more detail in the following slides. Next slide. This is information about the project abstract. It should reflect the title, which is Leveraging Health Service Equity for Sustainable HIV Epidemic Control, and have a summary of the activities and the description of the impact expected, as well as the funding amount requested for the period of performance. And this should not exceed 1 page. Next slide. Then there's a project narrative, which has several sections, which again, I'll go through in more detail. And you can also refer to pages 12 through 21 of the NOFO for this detailed information as well. Next slide. In the introduction section, you'll briefly describe the project purpose, design, and rationale, discuss how the program will engage and collaborate with stakeholders, and describe the consortium's responsibilities for carrying out the project activities. Next slide. In the needs assessment section, you'll want to clearly summarize the gaps and challenges in achieving and sustaining HIV epidemic control and the UNAIDS 95-95-95 goals in PEPFAR countries with a specific focus on Zambia, Malawi, and one additional PEPFAR country. Make sure that you outline the needs of specific populations and geographical areas, the complexity of providing HIV care to patients with coexisting conditions, discuss any health system challenges affecting health service delivery and the availability, effectiveness, and capacity of the health workforce, discuss the need to develop sustainable, differentiated models of care, a concise summary of the literature related to transitions of HIV and other health programs that are implemented by foreign entities and transitioning to host country governments and the best practices, and discuss the current health system and health management issues and components requiring additional support. Next slide. In the methodology section, you'll want to describe in detail using SMART objectives, which are specific, measurable, achievable, realistic, and time measured, and goals and intended outcomes of the proposed project in Zambia, Malawi, and one other PEPFAR country. You'll describe the key activities proposed for accomplishing the project goals and objectives related to the 3 priorities outlined earlier, and discuss how you will build and maintain effective strategic partnerships with relevant government agencies, academic institutions, regulatory bodies, health management teams, civil society organizations, multilateral organizations, and other U.S. government-funded programs and stakeholders to collectively develop practical, unique, and innovative solutions. And you'll want to describe in detail your experience addressing improvements to person-centered care and services for people living with HIV. Next slide. In the work plan, be sure to describe the interventions that will be used to achieve each of the objectives proposed in the methodology section, and how the goals and objectives directly relate to the requirements and expectations of the initiative, and make sure that the goals, objectives, and outcomes are SMART to include all aspects of planning, implementation, and evaluation, and relate to the needs identified in the needs assessment and to the activities described in the project narrative. Make sure the work plan includes sufficient detail to support understanding, while recognizing that you will revise the work plan after the cooperative agreement is awarded and after initial consultations with HRSA and in-country stakeholders. And this will be included as attachment 1. Next slide. Additionally, the work plan should include a logic model for designing and managing the project, and it should summarize the connections between the project goals, the assumptions, the target population, and then the activities, outputs, and outcomes. This is not your work plan, and there's additional information on developing logic models is included as a link within the NOFO and in this slide deck. Next slide. And then there is also the resolution of challenges section, where you'll want to discuss the challenges that you're likely to encounter when you design and implement your activities, provide realistic and appropriate approaches used to resolve these challenges, and make sure to identify and describe potential barriers to program implementation and possible challenges in working in low resource settings across multiple countries and with local governments. And be sure that your solutions are reasonable and actionable to be able to address these barriers. Next slide. Then in the evaluation and technical support capacity section of the project narrative, you'll want to describe your capacity to monitor programs, goals, and objectives, and plans to track and quantify results through the utilization of tools and systems, either through custom indicators or standard PEPFAR indicators, the methods and measures that you'll use to evaluate the impacts of the project, and how the performance management plan will link to expenditure reporting for your project. The methods to effectively track performance outcomes and for data collection and management, strategies for developing and implementing a comprehensive evaluation plan to annually measure the impact of the technical assistance and capacity development activities on healthcare workers' knowledge, skills, and behaviors, and how your organization will establish baseline data and measure program, process, and outcome data in alignment with the host country and PEPFAR goals. Finally, the current experience, skills, and knowledge, and the strategy to collect, analyze, and track data to measure process and impact outcomes and data use to inform program development and service delivery is an important component of this section. Next slide. There's also a section for your organizational information within the project narrative that should describe your current mission, structure, and scope of current activities, and how these elements will contribute to your organization's ability to implement the program requirements and meet program expectations. The following should be included, which are your project structure description and organizational chart, management and staffing expertise and biographical sketches, your current global health federal grants and cooperative agreements, past performance references, as well as information on your organization's resources and capabilities to provide culturally and linguistically competent training and capacity development services. And please clearly describe how you will manage the cooperative agreement, including approaches to addressing potential problems. Next slide. I'll now hand it over to Marie from our grants team to cover the budget and budget narrative information. Thank you.
Thank you, Laura. I will now go over some budget information. I cannot stress enough the importance of following the instructions in HRSA's SF-424A application guide. It includes vital budget tips that will help guide you to submitting a successful application. Please also note that the total project costs include direct and indirect costs when forming your budget. Next slide. The budget will need to include the following: the SF-424A form, a year 5 budget as attachment 7, as the SF-424A only allows for a 4 budget period, and this is a 5-year project. A budget justification narrative as an explanation of your budget and an attachment of your indirect cost rate agreement. Next slide. The budget justification narrative is where a detailed explanation of the budget is to be described. Please explain how each cost element contributes to the project's goals, and be very detailed when explaining items in the other category. Please be concise and focus on the budget costs and the explanation for those costs. Do not expand on the project narrative in your budget explanation. Next slide. The budget should be aligned with the PEPFAR guidance and highlight activities directly linked to HIV. Again, please make sure to attach the 5th-year budget as attachment 7. Indirect cost rates are capped at 8% for foreign organizations. Next slide. Institutions of higher education and nonprofits should refer to the SF-424 application guide, as indirect cost rates may vary. I will now turn the presentation back over to Laura. Next slide.
Thank you. This slide just details a table of the various attachments to the application and whether they're required or optional, and whether or not they're counted towards the page limit. So you'll want to pay particular attention to this. Please carefully follow the instructions detailed in the NOFO for each attachment. Clearly label each attachment completed, and as I mentioned, be aware of what counts towards the application's page limit. This can be referenced on pages 21 through 23 of the NOFO. Next slide, please. This is a summary of the submission dates and times. It's due August 5th, 2022 at 11:59 p.m. Eastern Time. We do recommend submitting your application to grants.gov at least 3 calendar days before the deadline in case you need any additional support or encounter any issues. And please see section 8.2.5 of in grants.gov for additional information. Next slide. I'll now turn the presentation back over to Alpha to cover the review information and criteria in the rest of the presentation. Thank you.
Thank you, Laura Marie. So as mentioned, I will now review the application review criteria and scoring points as outlined in the NOFO from pages 28 to 34. So critical indicators have been developed for each review criterion to assist you in presenting the pertinent information related to that criterion, and then to provide the reviewer with the standard for evaluation. And these 6 criteria are used by the reviewers to score the merit of the proposed activities using the application in its entirety. Next slide. So here's the chart providing an overview of each of the 6 criterion and associated points for each for a total of 100 possible points. In addition, next slide. In addition, we have this crosswalk that's on pages 11 to 12 of the NOFO, showing which sections in the project narrative are associated to the related criterion or criteria, as shown on pages 11 to 12. I can't recall if I said that already. I'll now go through each review criterion. Next slide. So the first review criterion is the extent of which the application demonstrates the problem and associated contributing factors for the need. And this relates to how well the introduction and needs assessment sections of the project narrative demonstrates a comprehensive, up-to-date understanding of the progress, issues, challenges, and needs. Also listed here on the slide is many more considerations that need to be evaluated and included in the application response. Please refer to pages 28 to 29 of the NOFO. Next slide. The second criterion has 3 parts and is about the response to the NOFO for a total 35 maximum points based on 3 sections of the narrative: the proposed methodology for 20 points, the work plan for 10 points, and the resolution of challenges for 5 points. Each of these have considerations under this review criteria listed on pages 29 to 30 of the NOFO in order to evaluate how well what is being proposed in the application is capable of addressing the problem and attaining the project objectives as described by Laura earlier and enlisted in the NOFO. Next slide. The third criterion is how well the evaluation section describes the methods proposed to monitor and evaluate the project results. And the measures proposed will be able to successfully assess, 1, to what extent the program objectives have been met, and 2, to what extent these can be attributed to the project. So there's other considerations on pages 30 to 31 that include the strength and feasibility of the applicant's evaluation plan to develop appropriate evaluation tools, systems, and strategies, including data specific to the PEPFAR program, as well as the strength of the proposed strategy to collect, analyze, and track data. Next slide. The fourth criterion, impact, uses the work plan and overall application to determine the public health impact and the effectiveness proposed from the proposed project, such as plans for dissemination, results on the community, results of the impact on the community or the intended target population, the extent for the scale up, and of course to ensure sustainability. This includes the strength and feasibility of the proposed activities to smoothly transition HIV and related services into existing and or adapted health services, as well as the extent to the proposed activities align with the efforts to ensure that sustainability and continued momentum of HIV programs towards meeting PEPFAR goals and decreasing HIV mortality within the context of the local health systems. And of course, the strength of the proposed methods on the ability to disseminate the program findings, lessons learned, promising practices to relevant stakeholders, local communities, national meetings and conferences, and potentially peer-reviewed publications. Next slide. The fifth criterion, for a total of 25 points, uses the technical capacity and organizational information sections of the project narrative to ensure that proposed personnel are qualified with sufficient capacity for the needs and the requirements proposed in the application. So this criterion has four parts. The first is the organizational description and chart for 5 points that goes over the strength and clarity of the proposed staffing plan that's required and to be included in attachment 2, and the project organizational chart that's required to be included in attachment 5 about the project description and proposed activities, as well as the strength and clarity of the current organizational structure, proposed staff, or applicable consortium partners and scope of activities to contribute to that purpose, and the applicant's ability to conduct the proposed program. The second is on the management and staffing plan for 5 points, and that is really to include the extent of which the qualifications of the identified key personnel are and its ability to lead a project, as well as qualified to implement the project. The third is on administrative and fiscal oversight for 5 points on how well the plan outlines the roles, responsibilities, and functions of the applicant institution and any partners, the strength and feasibility of the proposed processes for oversight and technical assistance, and the extent to which the applicant demonstrates the capacity to financially manage a federally funded program, and including the capacity to develop a standardized method to manage, execute in a timely manner, and monitor awards. And the fourth part is for key collaborations for a total of 10 points under this fifth criterion. And that's the extent to which the applicant demonstrates successful established or planned partnerships with relevant ministerial, educational institutions, regulatory bodies, health management teams, civil society organizations, and other entities to successfully carry out the proposed program. The rest of the other considerations for these criteria can be referred to on pages 32 to 33 on the NOFO. Next slide. The last criterion is related to the support requested, where the reviewers will review the budget to see how, and budget narrative on how well the costs in the proposed budget and budget narrative align with the proposed project work plan and are justified as adequate, cost-effective, and reasonable for the resources requested. And the second, the reasonableness of the proposed budget for each year of the period of performance in relation to the objectives and anticipated results. There's more information on pages 33 to 34 for additional considerations. Next slide. As part of this NOFO, there is one funding priority for the HBCU initiative for a maximum of 10 points. To have provided services under the PEPFAR HBCU initiative to improve HIV care and treatment outcomes. There's more information on the fiscal year 23 planning level letters for Zambia and Malawi at the PEPFAR website on where we work, as listed for the fiscal year and previous fiscal years. 2 points are allowed for each priority factor, as listed on pages 34 to 35 of the NOFO for this funding priority. Please ensure for consideration for this funding priority that the documentation for each of those factors is included in attachment 11. Next slide. Again, to reinforce the importance of the HRSA's SF-424 application guide is that it is a companion to the NOFO as it is referenced throughout the NOFO. So please ensure that you have access to the link and information and follow those guidance instructions. Next slide. In addition, any applicant must ensure that they have a unique entity identifier, or UEI, in the System for Award Management, SAMS, on grants.gov. Please register with SAM to receive the UEI by following those links listed on the slide. You will no longer, please note, you'll no longer be able to use the DUNS number, as that number is no longer maintained in the new systems. For more information on this transition, you can visit the following web pages as listed on the slide. Please ensure that you register with grants.gov as soon as feasible, as it might take a number of weeks for it to be finalized. So please do not wait to the application or close to the application deadline to initiate your UEI request or ensuring that you are properly registered on SAM and grants.gov. Next slide. And just to provide an overview of some tips for completing your application, as just mentioned, make sure that you check your registrations in SAM and grants.gov, that you read the entire funding opportunity and HRSA SF-22-160 application guide, that you check your eligibility. This is open competition, and that your organization is eligible, and that for funding priority factors that you ensure that you include relevant documents as part of your application for it to be considered. And please ensure that your organization has the relevant technical expertise, personnel, and financial capacity in order to do the work proposed. The reviewers will be ensuring that the information provided is sufficient in order to carry out what is being proposed. And please ensure that your stakeholders are supportive and include those letters of support or memorandums of understanding as part of the documentation and the relevant attachments as supported. And make sure your organization is prepared to do what it takes to ensure successful grant management and under this cooperative agreement. And be sure to provide a comprehensive overview picture. And please keep in mind as well that the review criteria is laid out as the standards that is for the objective review committee to assess the technical merit of each application. And be sure to submit your application as early as feasible. Next slide. Thank you for your time and consideration for this webinar to go over HRSA-22-160 and then notice of funding opportunity. Now is a good time to take questions and answers. You may be able to raise your hand on the Zoom platform or provide the question in the Q&A button, or provide any reactions if you receive the information that you're looking for.
But there are a few questions in the Q&A section, which I'm not sure if you can actually see that section. So let me read them out, and we can also, I can type answers into that section. So the first question is that, could we clarify the total funding? Is it 10 million for the whole 5 years, or 10 million per year times 5 years? And I can provide that answer, which is that it's 10 million, estimated 10 million per year times 5 years. And I'll put that answer in the chat. The next question is this project expected to be implemented by one successful applicant in both countries, Zambia and Malawi? And I'll start the answer, and then Alpha, if you want to join in, that our expectation is that, yes, we will be making one award to one successful applicant, but that applicant, we're recommending a consortium of other entities and organizations that will be subrecipients that would also be implementing activities in the various countries. So Alpha, anything to add to that?
Just that for fiscal year 23, for the first year of funding, it is confirmed for Zambia and Malawi. And then there is the potential opportunity for additional countries in future years.
The next question is, what are the qualifications of the key personnel accepted by this call? I'm assuming meaning for this award. So were there specific qualifications noted in the NOFO?
So this is Alpa. So the qualifications that of the key personnel, the lead, must be as supported for the activities that are to be accomplished in the proposal. So there's not necessarily a specific where clinical qualifications, for one example, or additional subspecialties that's required per se in general. It depends on what activities are being proposed in your application, and that your key personnel that's leading as well as implementing has the appropriate qualifications that a review committee can assess in order to ensure that the activities can be fully carried out.
The next question is, reading through the NOFO, I found a part talking of addressing key population. Are we supposed to propose some activities on key population?
If relevant to the need that is being proposed to be addressed as part of your response, an applicant can consider key populations as appropriate. Key populations can include, can be included and can be defined as how PEPFAR on the website is defining key populations. There's also additional populations of as part of the remaining gaps for ending or getting to the UNAIDS goals of 95, 95, 95. So there would also be ensuring that there's opportunities to address activities in populations like adolescent girls and young women as one example.
There's a question on what are the selected provinces / districts of operations of this call in Zambia? So Alba, I'll direct that to you, but I'm assuming that the NOFO is requesting a general plan for the country. And then, yeah, for Zambia,
Correct.
but do you have more details?
No, correct. The NOFO is not specifying particular districts or facilities. There are activities that are currently happening in Zambia and Malawi. But this is actually intended to be a support and therefore not specified for which particular districts or facilities at this time.
There's a question about, as applicants, are we supposed to name this activity with a new name, or should we use the same name as the NOFO? My understanding is it's the same name as the NOFO, but Alpa, if you have more details for that.
You're welcome to name the project if that helps with the application, but we will confirm upon the award whether or not there'll be a particular name convention that's continued to be used.
There is a question on, can a consortium only receive the HBCU initiative priority factor points if the HBCU is the prime applicant, or can the consortium also receive this if they are a sub-grantee / partner?
So I'd like to ensure that there's not multiple applications from an organization or from a consortium. So a consortium would put together one application and that the points would be applied in its entirety to the application of a consortia or consortium. And so as a result, we want to ensure that attachment 11 includes the activities or sections or documentation of why the consortium in its entirety are able to meet each of the 5 factors under the funding priority in order to receive the full maximum 10 points.
Okay, and the next.
Did that answer the question? We're not expecting members of a consortia to be on different applications. But if you have sub-awardees as part of the consortia, please ensure that that relationship is explained as part of attachment 11 in order for the entire consortia to receive points for each of the segments. Meaning the lead organization does not need to be able to fulfill all of the factors for the funding priority, that they can have consortium members or partners be able to address it. It just must be included in attachment 11.
Okay, the next question is, kindly shed more light on registration to sam.gov and duns.sam.gov. Registration is complicated and we find it difficult to access our IUE number, but the account is active. What should we do in order to get the IUE number for sam.gov registration?
Hi, I can take this one. If you already have a DUNS number in sam.gov, then you should now have a UEI number. If you do not have a DUNS number and need a UEI number, you will have to begin that registration in sam.gov. But sam.gov is its own separate government entity, so you will have to follow the links that were provided in the slides, and they will be able to assist you because they're the only ones who can help you to get that number. But if you already have a DUNS number, then you should have received a UEI, because once the DUNS is now no longer valid, they should have given you a UEI number.
Thank you. The next question is, can an applicant be a prime in one application and a sub-partner in another application? I actually would defer to their grants or partners or alpha, or we could revert back with an answer if we don't have it right at this moment.
Thanks, Laura. It is not prohibited for one to be a prime that cannot be a sub for another, but please keep in mind that the consortium is a recommended entity. So, and that there is only one award that will be given.
Okay, the next question is, are there advantages to working with U.S. small businesses or local partners in Zambia? I think it's an interesting question, and Alpha, please chime in, but I would think in so much as these entities would be stakeholders that could increase the or strengthen the impact of your work, then certainly it should be included. Alba, do you have any other recommendations?
Yes, as part of the review criteria, it is included to how they ensure that the impact and sustainability is considered, and therefore working closely with local partners and demonstrating relationships with host governments in Zambia and Malawi can be very important and critical to the success of the application as well as the activities intended to be implemented.
There's a question on, is the total funding for all countries, Zambia, Malawi, plus one other country? So the total and estimated annual funding is the total funding across the whole award. So I'd say the answer is yes, unless you have anything to add there, Alpha.
Yeah, the short answer is yes. The total funding available for fiscal year 23 is for Zambia and Malawi definitively, potentially one additional country, but at this point for sure, Zambia and Malawi.
There's a question on, is HRSA anticipating or looking for consortiums with US partners as a requirement?
I can answer that.
Yeah, go ahead.
So currently the consortium with US partners is not a requirement. It is only in general recommended for a consortium in order as part of its strength to be able to identify in full the different components being looked at to be highly responsive to all the different elements and potential for future activities in not just Zambia and Malawi, but other countries as well.
There's a question about, is there a prerequisite for the additional country or countries in terms of location in Africa? And I believe that the request was for one additional country, a PEPFAR country. So there's not a requirement for Africa, but Alpha, anything to add?
I'm sorry, Lori, can you repeat that? I actually can't see the questions.
Is there a prerequisite for the additional country or countries in terms of location in Africa?
Not at this time. At the Where We Work on the PEPFAR website, when you look at the fiscal year 23 planning level letters, there was an opportunity for the activities to be considered in all 50 PEPFAR countries. So there is no particular prerequisite for the third country as an example.
And there's a request in the Q&A to share the answers via email address. And I think, could one of my colleagues speak to the Q&A document? How and where is that shared once we compile all of the questions that are coming in through this webinar and through email? And maybe my other colleagues are muted, but could I ask for support here with how HRSA will then post the Q&A, how that is shared out after the webinar?
Hi, I know a frequently asked questions document will be made of these questions, and it should be posted to the HRSA page. but I'm not sure what HRSA page exactly for the Office of Global Health. But it should be posted, and it may be easier if an email could just be sent out to all the participants with that information after this.
Thanks for that, Marie.
It will be posted on the HRSA Office of Global Health page and with a link to the initial NOFO. So we'll ensure that that is. My apologies. So it'll get corrected and posted similar to with a link to the grants.gov posting.
Okay, so the next question is, so year one is definite. I'm just reading this exactly as it is written. So year one is definitely only Zambia and Malawi and must be both. You can add another country in year two onwards, but could stick with just Zambia and Malawi for the whole 5 years. Alpa, my understanding is we'd like to see the plan for Zambia and Malawi for the full 5 years and a proposal for one additional country. Is that
Correct.
okay? And the next question is, which fiscal year the third country will start implementation if application is successful? Alpa, do you want to speak to the request for a proposal for a third country and how that will work?
Yeah, so the third country could, is potential for the second year, but there's still ongoing processes now where there's potential funding, but not confirmed.
The next question, and I may need to, if the Armstrong Gift Hamanza, who wrote this, might be able to type a clarification into the chat, because I'm not sure that I understand this entirely. Is there a restriction, the international types, and what is the accepted percent of personnel's salary allocation? If you might be able to type in the chat any clarification about your question. I'm sorry, it's unclear, and unless Alpa, you understand the question and want to try to answer it. The accepted percent of personnel salary allocation. I don't know if that means towards. I don't think I have a clear understanding of the question, so I'm going to jump over that one. And the next question is, how many other countries, in addition to Zambia and Malawi, can be included in the application? Do you have any guidance on that, Alpa?
Recording in progress.
My apologies. Can you hear me now?
Yes.
I'm sorry, my connection just got disconnected. If I heard the question correctly, can you repeat the question actually?
Absolutely. How many countries, in addition to Zambia and Malawi, can be included in the application?
We recommend considering one country at this time in addition to Zambia and Malawi. There is a page limit, and we want to ensure that current applicants are able to address all aspects as posted. So it's not required where it's only the 3 countries, but it's recommended.
Okay, and the next question is, how will the additional country be selected? Will the applicant include the additional country of preference in their application?
So
And
countries and activities are decided through the annual PEPFAR process through country operational and regional operational planning. And so we are currently wrapping up the fiscal year 23 process for annual planning. And each subsequent year that information and that planning will get proposed. So an applicant proposing a country does not automatically mean that that's the work that will happen. It's based on part of the planning process out of the Department of State Office of Global AIDS Coordination.
And then another question on the third country, will the third country be required to implement, collaborate with Zambia and Malawi, or can it be implemented independently? I think the activities would be independent and specific
Correct.
to that particular country, although it may build on strengths and best practices from activities in other countries. Is that
Agreed.
okay? Their next question is SF-424 in all forms, are they supposed to be submitted in PDF together with the full project technical application? I am going to refer that to grants or other team colleagues who may have experience with receiving these applications before and understand how the pieces are submitted through grants.gov. So
Yeah, they are submitted in grants.gov. So when you're submitting your application there, it will like guide you on how to submit the forms. We receive it on our end as one full application, but I'm not sure how they have you submitted in grants.gov. But usually they are in the PDF form.
thanks, Marie. And then there's just a response. I believe this is in response to Alpa's answer to a question that yes, it's clear that the lead could be non-HBCU and sub could be HBCU that fits the criteria as long as that HBCU is not on multiple applications. So just reiterating what you had shared, Alpa, that's clear. The next question is, in year one, should applicants propose to implement in both Zambia and Malawi, or can applicants propose to implement in just one? In subsequent years, should applicants propose to implement in additional countries?
So I'd like to answer the required activities for year one is in Zambia and Malawi. Other countries can be proposed for future years.
The next question is it mandatory to partner with a US institution?
It is not a requirement.
Another question is, as applicants, are we required to sign in all documents to be submitted, like is done in USAID, including the organogram? Is it, I'm not sure, and
Yeah, I don't think we require, HRSA requires it, but please, we'll confirm in the SF-424 guide.
and the next question is it necessary or optional for Zambia and Malawi to include the third PEPFAR country?
Activities proposed for Malawi and Zambia are required, with the proposed third country as an example of what activities would be feasible by the applicant to be responsive to the application, with the potential for it to be funded for year two.
Okay, and this is, I think this is a clarification of the earlier question. Is there a limit on the percentage of salaries and on the number of international trips? I guess that probably means as a component of the total budget.
There isn't a specific limit on those amounts, but please keep in mind that the budget does get reviewed and scored for the resources needed. And so all costs that are being proposed or resources requested and for what it would be utilized for should be reasonable to carry out the activities.
Okay, and the next question is, and this may be the last one, unless we get more, is in year one, are we required to submit the milestones for both Malawi and Zambia? Assuming the milestones are part of the M&E plan, then the answer would be
Yes.
yes. Okay. Those are all the questions that we have in the question and answer box. Sorry, one more. Is it okay to budget for 5 provinces in each country, Zambia and Malawi?
If budgeting for 5 provinces in each country is the best approach for demonstrating responsiveness to the components of the NOFO, then you are welcome to consider it. It is not a requirement, nor is it necessarily suggested per se. And then we see a question again about confirming again, to confirm the amount, it is 10 million is the annual amount for 5 years for a total of 50 million estimated over the 5-year performance period.
I believe those are all of the questions.
If I just want to add again, and that is subject to availability of funds.
These are all of the questions that I'm seeing in the Q&A section.
I believe we see some raised hands. Are we able to? We do have a couple of participants through a phone line. So are we able to allow them, if questions are needed, to be asked? Is it *6, I believe? Or am I on the wrong platform for that?
I'm not sure. Devlin, do you know if there's a way for callers on the phone lines to indicate if they have a question?
Okay, we're not seeing any raised hands. Any more questions in the Q&A
A
or in
question
the
about
chat?
whether participants can get a copy of the transcript for this meeting. And so I don't know if our grants office or one of my HRSA colleagues can chime in on whether what components of the meeting will be shared out and where. I think we already decided it's at grants.gov.
Yeah,
I believe it's on a HRSA website site that it's shared. Each program office does it differently, so I'm not sure how your guys' office does it. So I can't answer that question.
I'm
We
seeing
have a
a note that
HRSA OGH.
we will share FAQs on the HRSA website along with the slides. So it sounds like, oh,
And
and
the
the
recording.
recording. There's one additional question. Should the additional country budget for 10 million per year in their work plan? And I'd say no, the estimated funding per year available across the whole award is 10 million. So that would not be the budget for one country.
Correct. The 10 million is for all countries per year. So for year one, that's currently Zambia and Malawi. Potential for a third country.
Okay, so one of our participants with their hand up, Armstrong Gift, going to see if I can unmute.
And yes, you can continue to ask questions. Participants are currently unmuted. If you had wanted to, if you'd raise your hand and would like to ask a question.
So Armstrong Gift, Hamanza, you can ask your question. I don't see any hands up, so I believe okay, there's someone, Georgina, you should be able to speak.
Thank you very much. I'm Georgina from African Forum for Research and Education in Health. I want to find out if this opportunity allows for applicants to also include new staff, that's additional staffing that they would need to be able to execute the activities. Thank you.
Yes, new staff, if needed to be responsive to the application, can be included, but a position description and qualifications for that would need to be included instead of the resume. So minimum qualifications and the roles for those new positions would need to be included. Thank you.
There's a question about how are you planning to share the minutes for this meeting to all members? So the plan is on the HRSA, OGH's webpage on HRSA's website. There will be the FAQ document that will include all of the questions that were asked during this meeting and the responses, and a copy of the slide deck and a recording of this webinar. There's another question. Can applicants use 10% de minimis indirect rate?
Hi. If you are a foreign organization, the indirect cost rate is capped at 8%. And then for nonprofits and for institutions of higher education, you would have to check the SF-424 application because those rates may vary. But if you do not have one at all, you should be able to use the 10% de minimis. And if not, if you already have a indirect cost rate agreement, you should use your indirect cost rate agreement.
See no hands up, and I believe those are all of the questions that we have.
Were there any questions that could have potentially been missed? If you can repose it.
There's a question in the chat that says, could you please share the links to the slide deck and the session's questions and answers once they are posted on the HRSA website? I'm not sure by what method that's being requested to be shared. So can the person asking that question clarify? There's another question. Can equipment like vehicles be purchased? I think it is that it relates to the proposed project, then yes, but I don't know, Marie or Alpha, if you have more details on equipment.
If reasonable and appropriate in order to respond to the NOFO, you can develop your budget accordingly to include vehicles if needed.
Yeah, it depends if the program allows it, but if the program does allow it, there are additional criteria for vehicles. We will need 3 separate bids. So there's additional information that will be required. So if you submit your application and your budget includes a vehicle, a condition will be placed on the award where we will ask for additional information to make sure that the vehicle purchase is reasonable.
Then there is a question about, could we shed more light on the submission process? Is it by email? And again, it is, Marie, it's through
Grants.gov.
Yeah, you'll submit in grants.gov. So if you, I don't know if you've accessed the NOFO already, but it's in grants.gov. And when you go to grants.gov, it should provide you with all the information on how to submit all the documentation. That's all located in grants.gov. And if you have any issues with submissions, they are the organization that you will contact. They deal with all the submissions of all the applications. So you will have to contact them. I believe on one of the slides, we have information on grants.gov and the links. So that's what you want to be looking into. It will not be by email. All submissions are through grants.gov.
Sorry, I see the request for the link to the HRSA website. So just if you can stand by, we're seeing if we can get that and post it into the chat. We're just waiting on that, but I'm not seeing any additional questions. So thank you, Alba, for posting the grants.gov link. We're just waiting for the HRSA.gov link to the page where items will be, and then we can share that in the chat. And then I am not seeing any additional hands or questions. Okay, so it looks like Alpha just posted in the chat the site where these items will be posted on the HRSA.gov OGH webpage. Thank you. That's all that I'm seeing, Alpha. So over to you, Alpha, if you'd like to close the webinar.
Absolutely, sure. Thank you so much, everyone, for participating in this webinar and this call and your interest in the Notice of Funding Opportunity HRSA-22-160. We will be following up by posting the frequently asked questions and the slides and the recording on the HRSA website posted in the chat. And there is an opportunity to ask questions, and questions that have been asked separately will also be compiled in the frequently asked questions and updated as needed. Thank you so much. And of course, I'd like to thank my colleagues for the immense work that has been involved, and thanking Devlin Lee for the webinar Zoom link, Marisa Torres Ruiz and Blaine Getachew and Laura Ferradori, Marie Mahafri, and Ben Rindy for contributing to the NOFO and the slide deck. Thank you so much.